Today is Bell Let's Talk Day, and January 31st has become Bell Let's Talk Day in this country. And, the conversation that surrounds mental health, it's just fantastic what Bell has been able to accomplish in the last few years. Normally, we talk to celebrities who have dealt with their own mental health issues, and we will. People like Clara Hughes and Michael Landsberg and Mary Walsh. But today we're going to speak with a couple of people working in the community. Andrew Thompson is a counselor with Friends for Mental Health, and Diane Bates is a member of the board. Hi, Diane.
Hello,
Andrew, how are you?
Good morning.
Nice
Hi.
to see you. Nice name like that. Diane, tell me about your daughter.
My daughter is 25 and since elementary days has been suffering with different forms of mental illness that have been diagnosed as anxiety and depression.
When she presented with anxiety, depression in elementary school, which must be very upsetting as a parent, had you ever had any kind of experience with mental illness
None
at
at
that
all.
point?
No, it was a whole new world for
Yeah,
us.
so how does that change your life?
Incredibly, actually, it's in very positive ways because when you know that you can help somebody, and that's with going with Friends for Mental Health, the counselling I've got there has helped my husband and I find the path to support and help our daughter, and she is in a really good place now.
Andrew Thompson is a counselor with Friends for Mental Health. When people come to you, what kind of crisis are they in? What are they going through?
For the most part, I think it's a new diagnosis of some kind. People are searching for information, they're searching for support, they're searching for understanding to do what they can to support their loved one through whatever the crisis may be at that point. But often it is a new diagnosis, or it's sort of the first sort of outcropping of the symptoms.
Is there a simple way? Let's talk about depression, for example. Is there a simple way that you can tell the difference between, I'm just upset because this is happening in my life. I'm going through a breakup. I'm going through a divorce. I've lost my job. Between that and being actually capital D depressed?
I think for the most part, the clinical definition would rest mostly on the amount of time. And I think it's also important the environmental factor. So if someone's going through divorce, I think there's a natural grief process. If someone loses a family member, I think there's a natural grief process. That being said, for the cutoff, I think for depression would really be the amount of time that the person suffers with those symptoms, the intensity as well.
So if it goes on and on, say it goes on for weeks and weeks, and you're
Exactly,
crying on a daily
exactly.
basis, you can't seem to cheer there's nothing. You lose interest in the things that you liked to do before.
Absolutely. It's not the daily fluctuations
Right.
in our mood that occur because of all, our stressful lives, our jobs, our families, that's normal, but we're talking sustained periods of time.
So I understand very well what is depression because I went through depression. But explain to me when people present with anxiety, how would that manifest itself? What is anxiety?
There are several different anxiety disorders specifically, or someone may suffer from social anxiety, so that fear of being in large groups or talking in public or spending time with others. They may suffer from agoraphobia, or they may suffer from just generalized anxiety, where there's sort of an anxiety, an apprehension, a fear that is on all of the time, all day, regardless of the environment, regardless of the situation.
So Andrew, what would you suggest if somebody is listening right now and they think that there might be something that's not quite manageable on their own? What do they do?
I think always the best thing to do is to reach out to family members. I mean, that's why an association like ours exists. If you can, if you feel comfortable.
It's funny. Some people are scared to even reach out to family, and in some cases, in some cultures, even after I came forward last year, people said, "Listen, I've never told anybody, and even when I've tried to bring this up, my family doesn't believe." They say depression doesn't exist in my country.
That's an excellent point. I mean, that's one of the barriers we see a lot is working with individuals from, varying backgrounds, varying cultures, where there is a barrier to the initial stage of acceptance and understanding.
But it's a doctor or
present.
somebody you can trust that you can speak to.
A professional, someone in the educational field.
Right.
I think really just someone you feel comfortable talking to and having an honest conversation about
That's
what you're going through.
what I always say is somebody you trust. Diane, what's been your experience with, since you've become so involved and people, using you as somebody to go to and confide in?
What I found with my daughter is that she didn't want to be a burden to us, and therefore she didn't share. When she went to university, she moved away. She was at McGill, and the second semester she did not go to class at all. I don't think she ever got out of her pajamas.
And she never told you?
Never told us.
Wow.
She came home every weekend. And when she did tell us, after she'd seen her doctor, and she has a great support team of professionals as well as with her family, I said to her, but we saw you every weekend. You were so happy. And she said, I was happy to be home. But
It's
she hadn't shared with us.
It's heartbreaking.
It is heartbreaking. And we had a conversation yesterday about the signs where she needs help, when she stops communicating with us, when she doesn't return texts, when she starts withdrawing. Because she lives away from home.
Yeah.
She's just started a course at John Abbott College. And to watch out for those signs. And we need to be very sensitive to understanding our loved ones and knowing when they're showing that behavior that they may be in stress.
Diane Bates is a member of the board of Friends for Mental Health. Andrew Thompson is a counselor. They do work out on the West Island. So if that's your area and you want more information, I'll give you a phone number to call: 514-636-6885. Or here's a website. It's called Friends for Mental Health. So ASM FMH stands for what, ASM? It's
Amis Santé Mentale.
Friends for Mental Health. Okay. ASMFMH.org is a website. Thank you so much for coming in today.
Thank you for having us.
And thank you so much for having us again.